So shoulder joint is one of the most mobile joint in the body. It is a ball and socket joint, and it's one of the most common joint to be injured or causing pain and stiffness. I'm Dr. Kaushik Reddy, consultant orthopedic surgeon working at Apollo Hospitals, Jubilee Hills. So why does my shoulder hurt? Reasons why a shoulder is painful are, one of the most common reasons is a rotator cuff tendinitis. So rotator cuff is a group of 4 muscles which become a tendon which attaches to the ball of the shoulder joint. So this rotator cuff is helpful in lifting the arm above the head and for all the range of motion activities of the shoulder. So this rotator cuff tendinitis is inflammation of this tendon, where the tendon becomes swollen. It can happen during your day-to-day activities or because of an injury. Then the other most common is an impingement syndrome, where the rotator cuff tendon gets impinged under the bone above the ball of the shoulder joint, which is called acromion. So there will be pain in a particular angle, which is called impingement syndrome or a painful arc syndrome. Then third most common is injury. Any injury to the shoulder joint during your activities or because of any fall can cause a fracture or dislocation or any tear of the rotator cuff or cartilage or any labrum. Then the other most common is arthritis. Arthritis can occur because of an injury which is called as primary osteoarthritis. Arthritis is one of the common causes of shoulder pain. Arthritis can be primary osteoarthritis or it can be secondary arthritis, which is caused usually because of an injury. Primary arthritis can be caused because of degeneration, wear and tear, or because of any other inflammatory joint problems like rheumatoid arthritis. Then because of injury, fractures are common in the shoulder, dislocations are also common, and last but not the least, the most common causes of shoulder pain and stiffness is a frozen shoulder. Frozen shoulder occurs commonly in people who are in 50s or 60s age group, women who are suffering from diabetes or cholesterol problems or thyroid issues. So in all these things, the shoulder pain and stiffness will be present, especially night pain will be present. Activities like movements of the shoulder joints will be affected. It will be painful. Not able to lift the arm above the head. Combing your hair will be difficult. Bathing will be problematic. So how to diagnose this shoulder pain or the cause for the shoulder pain? So if you are someone who is suffering from any of these symptoms, then you have to consult an orthopedic surgeon, where he will do a clinical examination and try to identify the reason for the shoulder pain. He may advise an X-ray or an ultrasound scan or an MRI scan to identify the cause for the problem and identify the diagnosis. Then the treatment options. Various treatment options are available, like depending on the cause and the severity of the pain, like physiotherapy, medications, injections in the shoulder, or surgery also may be needed. Then how to avoid or prevent the shoulder pain. Regular shoulder exercises, stretching exercises, and strengthening exercises of the rotator cuff and deltoid. By doing these exercises, you can avoid any shoulder pain and stiffness. Thank you.